Good day, sir. I am Noraifa, Kapampangan, and for today's video, I will be performing a written demonstration of ear irrigation procedure. So, ear irrigation is a routine procedure used to remove excess earwax or cerumen and foreign materials from the ear, and the ear naturally secretes a wax to protect and lubricate the ear as well as to keep debris out and hinder bacterial growth. So the purpose of this procedure is to minimize the risk of damage to the ears. Sometimes foreign materials like food, insects, or small stones can get into the ear. And in these cases, the goal is to remove the items safely and quickly before they move deeper into the ear or do damage to the delicate canal. And ear irrigation can be effective in removing foreign materials from the ear. So to begin with the procedure, you have to take a comprehensive history to determine if there are any contraindications to undertaking ear irrigation, and check whether the patient has had his or her ears irrigated before, and perform oral assessment and oral examination. So if you suspect any contraindications, refer back to the patient's doctor, and ensure equipment has been cleaned and disinfected as per manufacturer's instructions prior to use, and explain procedure to a patient and obtain informed consent as per form institution policy. And if the person lacks capacity to consent, the procedure can still go ahead if it is in the person's best interest, and the appropriate steps have been taken to assess this and document it, and explain the need for the patient to inform the nurse or of any adverse effects during the procedure, and ask the patient to sit in a comfortable upright position on a chair which supports their back, and drape a patient's neck and shoulders with a protective cover. And then have a patient sit up or lie with head tilted upward, and the side of the affected ear. You have also to wash hands and put on a plastic apron and gloves. So assuming that this is the apron, and then we have also to put on gloves. And then have a patient sit up or lie with head tilted upward and the side of the affected ear. And have patient support a basin under the ear to receive the irrigating solution, and ensure good lighting, and clean pinna and meatus at the auditory canal as necessary with applicators dipped in warm tap water or irrigating solution, and then you have also to fill bulb syringe with solution. If using an irrigating container, allow air to escape from tubing. And then you have to straighten auditory canal by pulling the pinna up and back for an adult, and straighten back for a child over 3 years of age, and down and back for an infant or child up to 3 years of age, and direct a steady slow stream of solution against a roof of auditory canal using only sufficient force to remove secretions, and do not occlude auditory canal with irrigating nozzle, and allow solution to flow out unimpeded. And then, when irrigation solution is completed, place cotton ball loosely in the auditory meatus, and have patient lie on the side of the affected ear on a towel or absorbent pad. And then perform hand hygiene and document in nursing notes which ear was irrigated, appearance of drainage and condition of ear after procedure, and patient's response, and return in 10 to 15 minutes and remove cotton ball and assess drainage. So that would be all. Thank you.